Okay, we're starting part three. What's up with the BBL smell? Is that for real? Remember, part one, part two, now we're on part three of BBLs. Thank you to those who requested that I cover this topic. It's a really important topic to cover because BBLs and plastic surgery in general is not going to stop. But understanding what the complications are, what could occur, how to mitigate those complications, finding a board certified physician and getting a proper consultation at a licensed clinic is what's going to help you. It isn't always about the money. Remember, it's about your life. So let's go on with this. What in the world is the BBL smell? Come on, do they really smell? The truth is, they really don't. All right, so what's going on behind all this? It's everywhere on social media. The truth behind the online claims are that it's a myth that's taken out of context and is more likely the natural surgical and healing process, which includes blood and fluids that have an odor. Some of the reasons that some people can have an odor or smell pretty bad after a BBL or really any surgery is bacterial overgrowth, a lot of fluid and secretions, uh, poor hygiene, just poor hygiene overall, a lot of sweat that's pooling, bacteria then is growing, smell is occurring, and a lot of people, not everybody has the best hygiene. Okay, so if they go into a BBL with not the best hygiene, then maybe they're not going to have the best when they come out of it either. But what needs to be done for sure is you will have compression garments. You want to have two sets at least, because when you take one off, you want to wash that while the other one, the clean one, is going to go back on after you cleanse and gently clean off the fluid and secretions. The hygiene is difficult to do on your own when you are swollen and you're in a lot of pain and you're laying in positions that don't help you at all to twist and turn and get the proper hygiene done. That's where you need to either hire somebody to help you, who might be a caregiver, have your parent or your sister, or if a man had a BBL and you would rather have a brother, an uncle, a father help you, or again, you hire somebody that knows what they're doing and can wash you and keep you properly cleaned to keep that odor down. It is true that post-surgery there is a specific smell. You just smell it. It's just a lot of the blood and fluids, and it's a lot of the bandages that are now getting soaked with blood. It is the healing process. But if it's this extremely foul and god-awful smell that people talk about on TikTok for the BBL smell, then that could mean an infection. Is there a fever? Is there pain that is not getting resolved with proper pain control from the medication from the provider? Is it that you cannot get the cleaning done, so you need to come in even and have them look at your skin behind these compression garments and dressings and help get you clean? Is it a UTI? Could it be some other reason? Maybe you have a fever. You need to talk to your doctor and get a follow-up appointment, or speak to your physician or the nurse immediately if you feel that it might be an infection. Because the smell that people are talking about, they talk about it like it's just like the worst, most god-awful smell they've ever smelled in their life. But maybe you just haven't smelled people post-surgery. I don't know. But it could be infection. It's a lot of hype. People do the best that they can to clean themselves. They're not doing this on purpose. They don't want to smell bad. Most people really some people don't have the best hygiene, but they don't want to have an infection, and they're not trying to smell bad. They actually are probably very embarrassed that it's coming off that way to other people. If you are helping somebody recover, just do your best to keep these things clean. And I mean, I'm including like the sheets that they're laying on, any blankets, pillowcase, pillow, not just the clothes that they're wearing or the compression garments or dressings. Keep all of it dry and keep all of it clean, and follow the post-op instructions to a T. If the doctor gives you antibiotics, make sure you take those antibiotics. Make sure you call the physician with any concerns ASAP. This is just for educational purposes. I'm not a physician. I'm just giving you information on the BBL as a registered nurse, and some things are common sense, but not everybody knows that. They don't know that redness and tenderness and a lot of fluid coming out and a fever might mean infection. Not everybody knows that. It might seem common sense to some, but not to others. Okay, bottom line, maintain good hygiene. And don't make somebody feel embarrassed for the way that they smell. They might not know it at all. Just help them keep things clean, help them around the house, help do the laundry, and help them in the shower. So love your body, take care of your health, and remember, beauty should never come at a cost of safety. If you like health topics, if this was interesting, please consider sharing, consider subscribing, and give me some other ideas. Thank you for telling me that you are interested in the BBL and all about it and about that odor myth that's going on. I hope we cleared it up. I'll see you at the next video. Please consider subscribing and give it a thumbs up.